All right, hi everyone, welcome back to clinic at Harley Academy. My name's Dr. Tristan Mehta, and today we're joined by Charlotte in clinic. Welcome, Charlotte.
Hi.
So today we're going to be showing a biostimulatory treatment, and we're going to be using a product called Ellansé. And what's interesting about these products is that they can be typically used for patients that have signs of aging, but they can also be used quite similar structurally like hyaluronic acid gels. And so we've got Charlotte, who obviously doesn't have any major signs of any aging, but still would be a really good candidate for this skin regeneration, this biostimulatory process. Charlotte's previously had very minor amounts of injectable treatments, and is here today just for a kind of full face assessment and a chat. So let's start off with Charlotte. Tell us, welcome to clinic.
Hi.
Could you tell us a little bit about what's the main concerns for you?
Just mild jowling at the bottom here, so it feels a bit heavy around the bottom of my face, and just requiring a little bit of balance on the cheek. On the cheeks. Very good. And can we ask how old you are? 40.
You're 40. So I think you'd all agree Charlotte looks very good for 40. She's very well preserved in terms of her volume, in terms of laxity. There's very little clear signs of the traditional signs of aging, which would be kind of volume loss here and jowling. And so what we're looking for here is this a really good case to demonstrate how these biostimulators can be used for this revitalization of the skin, but also to create this structural component as we stimulate the deeper collagen in the tissues. We do have a very beautiful upper face, symmetrical eyebrows, convex forehead, and very full temples. The volume in the temples is very, very youthful. Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our Injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like. I noticed in the midface, we start to lose a little bit of the definition of the cheekbones laterally. And I think we have excellent anterior projection here, but then we start to lose a little bit of that really nice definition that I think would look really good for Charlotte's in the lateral aspects of the cheek. I do notice here that we start to see a little bit of laxity of the skin. I think this is what's starting to contribute to this very early, I wouldn't call it a jowl, okay, but we're starting to see a little bit of, I'll call it an interruption along the jawline. And so if we use a biostimulator to really try and tighten the skin and improve the skin back here, we will notice a more striking jawline. And that will also reduce the little divot that's appearing just to the side of the chin here. If you look all the way on profile, you may notice that Charlotte would benefit from a tiny bit of chin projection as well, just to balance the profile of the face. But otherwise, if you look at the rest of the face, I see a youthful patient in her, I would say, early to mid-30s. And so what we're trying to do with the biostimulator here is just try and improve the tightness and the condition of the skin in the lateral aspect of the face, so that the whole face is in keeping with that presentation. So does that sound good?
Yeah, sounds very good.
The final thing I wanted to point out is that we do also have hyaluronic acid gels, and we can use those in strategic places where there's deep volume that you want to create projection. And you may notice that we could benefit a little bit from some deep volume down at the base of the nose. That's the piriform fossa. And so it may be tempting to do an injection down here, because as we age, we lose this maxillary bone support and the angle decreases and we start to get these shadows. And so a single injection either side at the base of the nose, the piriform, deep piriform space, could be of benefit to Charlotte as well. So with that in mind, let's get ready for the treatment, and we'll show you how we reconstitute and use Ellansé, the biostimulator.
Hello, I am Dr. Harriet. I am one of the aesthetic doctors here at Harley Academy. My time here, I spend doing treatments on patients and also training lots of our medical professionals in aesthetic medicine. I'm also the medical director here, so I spend lots of my time overseeing patient treatments, making sure everyone is safe and happy.
Okay, so we've got Dr. Harriet joining me in clinic today, and Harriet's one of our senior medical trainers, and she's going to be helping me to reconstitute the Ellansé. So Harriet, talk us through your plan.
So I have got my syringe of Ellansé here. It comes in a 1 ml syringe, and you can see it's like a opaque white gel. I've already drawn up some lidocaine. I've got 0.2 ml of lidocaine here, and then I've just got a connector that I'm going to use to mix the two. The two actually mix very nicely together. It doesn't take too much effort, but using this connector is really helpful. So try not to touch any of the ends. I'm going to connect the gel on now. And you do want to try and do it nice and firm. The syringe that you've got your lidocaine in, it's helpful if it's got a lure lock, because you are now going to use a little bit of pressure to just agitate the gels between the two syringes to mix up the lidocaine nice and evenly throughout your Ellansé. That leaves you with 1.2 ml of product to now inject.
Okay, so let's start by marking up our treatment plan for our Ellansé treatment today. First thing I'm going to do is find the bony landmarks I always like to draw on my patients. So we have the temporal crest, and we have the superior aspect of the zygomatic arch. So this gives us our temporal fossa posteriorly. I'm also going to mark on the underside of the zygomatic arch as well. And so you can see between these lines, the direction of the cheekbone is in this direction. And that's going to be important because I'm going to try and create some of this structure underneath the skin that follows her natural cheekbone to give this beautiful lift to the lateral midface. The other thing I want to point out is something called the line of ligaments. So if we connect here the lateral orbital thickening to the origin of the zygomatic cutaneous ligaments and the mandibular ligaments, and you draw a line from the temple through these ligament insertions, what we see here is we can divide the mobile midface from the passive midface. And I'm going to demonstrate that right now. So if I put my finger here on the cheekbone, if you give me a really big smile and relax, my finger doesn't move. Smile again and relax. Where I put my finger here and then smile and then relax, you can see that it's moving on again. Smile and relax. It's moving my finger. Okay, so what I'm demonstrating there is that the muscles in front of this line of ligaments are responsible for lifting the corner of the mouth and lifting the lip and smiling and expressing. And those muscles mean that we have a very active component of the midface. If we put a lot of volume on top of those muscles, then the patient, when they smile, can look very overfilled and unnatural. Whereas if we're trying to inject behind those muscles, we're not worrying about this tissue moving on expression. What we're thinking about here is actually injecting either deep or superficial or acceptable. And when we're using a biostimulator, we want to be treating just underneath the skin to get the most dermal stimulation. And so one of the advantages of using a biostimulation in a patient like this, when we're trying to lift along the jawline like this, is that we can treat this entire area just under the skin with Ellansé. And what it will do is we will create this beautiful biostimulatory effect, and we'll get this lateral lifting direction, this vector. And we don't have to worry about injecting just superficially, because we're not worried about that product moving on facial expression. Whereas generally more medially, even if we're using a hyaluronic acid or a biostimulator, I'd be nervous about injecting a lot of volume on top of the muscles of facial expression. So this line of ligaments is an important line to consider for all kinds of injections, especially biostimulatory fillers. So just to confirm, the way in which the aging process happens in the posterior aspect of the midface, or the lateral midface, because these layers are concentric, the skin, the fat, the muscle, we start to get this passive sagging, and we can start to get this appearance of an early jowl. And it's exactly for this same reason that we have these concentric layers that we can also think about repositioning as our strategy. And one of the advantages of a biostimulatory injectable is we can start to think about not just treating volume loss, but also repositioning the tissues this way to try and improve the main concern for Charlotte. In addition, I'm going to continue my biostimulatory treatment all the way to the chin. And the reason I would do that in this case is I noticed that I want to create a little bit more projection in the chin, if it's possible, just a little anterior projection. But I'm also going to try and create the same improvement to the skin in the chin and the medial aspects of the jawline. And this will then help the entire appearance of this transition from the lateral midface all the way through to the chin. This area is very tightly adherent to the underlying muscle and fat. And so you'll notice that when I'm injecting in this part of the face, there's a lot of space for my cannula to pass. But as I start to move medial to this mandibular ligament, it's going to be a bit more tight and a bit more contained, but we can still use a cannula to try and treat into layer 2 to try and improve the overall transition from the jawline through to the chin. So that's going to be my strategy for the biostimulatory effects. It's worth remembering that we can use Ellansé anywhere. We can generally inject it under the skin or deep to the muscle down onto bone in certain areas of the face. In this case, it makes most sense to treat here. There are some areas that we would not use biostimulators, okay? We wouldn't use the biostimulators in the lips and the very perioral region, and the same applies to the under eye region, and that's because of the mobility of those tissues and the risk of forming nodules. I'd also be nervous about injecting a non-dissolvable injectable in the extremely, I would say the relatively higher risk zones of the nose and the glabella. So those would be my no-go zones for injecting Ellansé personally. The final depth that we need to be nervous about, or we shouldn't go to, is the intradermal depth. And we don't want to, as much as it's good to get a biostimulator on the underside of the dermis, we don't want to be injecting inside the dermis, which could cause very firm nodules on the surface of the skin. Otherwise, I'm going to show you my injection technique for using biostimulators generally to get the best results and to avoid complications. And as I do that, I've got Dr. Harriet with me, who's going to be talking through some of the science of the products at the same time.
So, Dr. Tristan, what's going to be your sequence to approach?
So I think we'll follow the same strategies we always follow with injectables. We'll start from the top down and we'll work lateral to medial, which means that generally I'm going to start back up here, temporal and the lateral aspect of the zygomatic arch. Then I'll treat the preauricular area, posterior aspects of the jawline, and we'll work our way towards the chin. So I'm going to be using a 22 gauge cannula. So if you could help me with that, Harriet. Okay, turn this way for me, Charlotte. Thank you. So we're going to make an entry point here. Tiny scratch. Perfect. Okay, so here I've got my first syringe of Ellansé mixed with the lidocaine, and this is the kind of depth we want to be in to get the best stimulation for the dermis. And you'll notice my injection technique here. I'm just gently pushing through the little fibrous septa that divide the subcutaneous fat. And it's really important that we do check for depth here. Turn this way a bit more. What we see on ultrasound is that often the injectables can end up in the parotid gland. And one of the main reasons I'm using a 22 gauge cannula here is because it helps me to control depth better. I'm more likely to stay in the same injection plane as I'm injecting and not likely to dive into the underlying important structures in this part of the face.
I often find that slightly angling your cannula so your wrist is slightly down and the cannula tip is slightly up just can help if you feel like you're getting tangled in some of those fibrous bands that are a bit more likely to pull your cannula down and then enter into that parotid tissue.
And you see a lot of this on ultrasound as you're starting to scan our patients?
Absolutely. I think previously we always assumed the patient would feel it, or we would feel it as injectors if our cannula slipped into that glandular tissue in the parotid. But actually, patients don't seem to notice it. We definitely can't feel it when we've got the cannula there. So we need to do everything that we can to try and stay superficial.
Agreed. So one of the things I'm just showing you here is that as we start to change direction with the cannula, it's a mistake to think you can go from here to here. Okay. What we need to do is we need to almost entirely come out to be able to change direction and then be able to move into part of the jawline here that I want to try and treat. The other thing is that when I'm injecting, I'm doing a linear thread and then I'm going to stop here. I'm not injecting this initial centimeter with biostimulator. And that's because as I will continually treat this little part of the tissue, the risk with a biostimulator is that I create a nodule because I'm injecting over the same place multiple times. And so I'm very careful that I'm thinking exactly where my biostimulator has previously gone to avoid the risk of nodules. And I think it's worth us talking about that. I think people worry about biostimulators as the fact that they can't be dissolved and we have these vascular risks. But the real risk that I think people need to be aware of is the risk of causing nodules. And Harriet, do you want to talk us a bit through what you think about those?
Absolutely. That's a much more common risk that we'd see with these types of fillers in the biostimulatory family than actually causing vascular adverse events. The substance that you're injecting now is made up of polycaprolactone, which actually is very smooth to inject. It's little spheres of very stabilized polymer that's sitting within almost like a water gel. It's made up of carboxymethyl cellulose, which we use in all sorts of different ingredients all across medicine. And it makes this very smooth gel for you to inject. And you can see now through the skin, it's going very nicely and integrating into the tissues. But you're right, what you don't want to do is have too much of this substance aggregating or clumping in one area, because the long-term effect of these treatments, the magic of why we like them, is that they do have an inflammatory effect on the tissues and they will start to stimulate some of that collagen, which is great. That's exactly what we're after. But in small amounts, balanced across the tissues, having too greater inflammatory reaction in one area, that's when you're going to start to see your nodules. And the difficulty with these products is that they tend to form these very clever little walled off nodules, which can become really difficult for us to penetrate and to break down. It's not impossible, but they're not easy. So always, first principles, prevention is key. So the techniques of injecting little amounts, not all in one area, nice and balanced out, not treating too superficially into that dermis. So you have to be really careful with your entry points of your needles and when you're withdrawing, that you're not injecting any of the substance. All of those things can help to minimize the formation of those nodules.
Perfect. Thank you, Harriet. What I've been doing just over this last minute or so is I've been trying to create some subdermal structure along the jaw, along the cheekbone here, to try and create this lovely feminine angulation to the lateral aspect of the cheeks. And so I'm just focusing my injections along the cheekbone where I see it, but treating in the subcutaneous depth. And we'll see this in a few months' time. Hopefully we'll have noticed an improvement to the definition along the cheekbone. Again, I'm following the principles Harriet's mentioned, where I'm not creating a singular large nodule of this product in any given place, and I'm constantly moving the cannula as I treat. But that was me injecting our first treatment of Ellansé. And how was that? Was that okay?
It was okay.
Comfortable? Great. And what I'm going to do now is I'm just going to take the opportunity to just feel under the skin, make sure I've got a nice even spread of the gel. And I've treated this entire lateral aspect of the midface. And even though this isn't a representative view of how the the ultimate result would look like, it's important for people to see what people look like immediately afterwards. So if you can just sit up and look into the camera for us. Perhaps you can notice where I have injected this gel on this side, where you can see a little bit of the cheekbone that I've created, and you can see a little bit of lifting and fullness on that side, which is then going to start the biostimulatory process over the coming weeks and months. I'm just going to rest you back. And whilst I'm continuing on this side, turn this way, please. Thank you very much. Harriet, can we talk a little bit about what patient can expect to see over the process of a biostimulator treatment like Ellansé?
Absolutely. Yes. They work a little bit differently to the traditional HA fillers that we're used to, where we inject the volume, have maximal effect on day one, and then they start to break down over time and we lose the volume. With these, they work a little bit differently. So that carrier gel that we were talking about, that CMC, is the initial volume that you see under the skin. So it's that water gel that's sitting there that's giving us the initial results. Over time, that gel will just start to break down. It's a very stable polysaccharide that just breaks down eventually into carbon dioxide and a bit of water, and we just excrete it. As it starts to break down, it starts to expose this PCL that's in there, and that's what's going to start causing the inflammatory reaction to start creating some more of our own collagen. The collagen will then replace the gel as the actual volume. That happens as a slow process over time. So often what you'll find is as the kind of carrier gel starts to wear away, you might have a little bit of a dip in the volume that you're seeing. But then what you're replaced with is much more holistic and much more longer lasting, because it's your own collagen that's then going to sit there and give you the volume and the kind of the firmness, that little bit of tightening and lift that the patient's after.
Harriet, and who would you say is an ideal candidate for Ellansé, and who would you say is not a good candidate?
I think there's very few patients who are not good candidates for Ellansé. You as the injector are very much in control of how much you are putting in. And so I would say you end up with a sliding scale with your younger patients, say in their 30s, you're probably only going to use 1 or 2 syringes. Whereas when you have your patients in their 50s and 60s, that's when you're using a lot more mils, because you have a lot more work to do in terms of trying to rebuild those collagen stores for them. Mm-hmm. But starting early as a gentle treatment to try and maintain collagen stores, I think is a very good idea. The term collagen banking is very popular now in aesthetic medicine, and this is just another modality to help stimulate more collagen in the right areas.
That's really interesting, and a lot of injectors might not quite appreciate or understand how we know that all the fibroblasts live in the dermis, right? And we've got this biostimulatory mechanism. We're upregulating fibroblast activity by creating this inflammation, okay? And we're getting type 1 collagen production from our fibroblasts. So it makes sense in this way that we're injecting underneath the skin. But what about deeper injections with a needle? Can you explain to injectors why we might also want to use biostimulatory products down onto bone, for example?
Well, the studies have shown that actually our knowledge of the structures and the cellular makeup of the anatomy of the face is not as binary as we thought. Actually, you have these fibrous strands that are going down from the dermis all the way down to the periosteum. So you'll find fibroblasts and collagen actually all the way in all of the layers. And so it works on very much the exact same principle. What you may find is that you'll have to put a slightly larger injection into those areas, which is in keeping with what we would normally do with HA filler. Whereas when we're using it just subdermally, like in this instance, where there is the bulk of the fibroblast, we tend to find that we need to use much less gel to get the same amount of result.
Great. So on this side, I've just done the same as before. I've treated subdermally throughout the lateral aspect of the midface. And now I'm just focusing on the cheekbone itself, and trying to create this nice definition moving laterally. I've saved about 0.4 mils of my product on each side for this specific ridge of definition that I'm trying to create for each cheekbone. Okay, last little bit now. And we can take a look. Okay. Okay, again, I'm just going to take the opportunity to massage and make sure that there's no obvious nodules of the early Ellansé that's been injected. And for me, this all feels very nice and smooth. And I can make sure that I've got a nice shape to this cheekbone as well. Great. Now let's take a look again. If you can sit into the camera. Perfect. So your patients are not going to look particularly bruised or particularly red, or that there's a lot of inflammation after their initial Ellansé treatment. If anything, it's like they've had a very gentle filler treatment and they've got a little bit of volumization from this gel that carries the active compound, as Harriet mentioned. And so patients may not notice really much of anything in the first few days, apart from a little bit of subtle volume. But we really start to see that biostimulatory effect take place in the coming weeks after treatment. So the final thing I'm going to do now is just continue from the mandibular ligament down towards the anterior chin on each side, staying with a 22 gauge cannula. I'm going to use half of it on this side and half of it on this side. So how quickly can patients start to see results with biostimulators?
So you obviously have the initial volumizing that we can see on Charlotte today from that water gel. So it gives you a nice idea of what's coming. But really, with any true collagen stimulation, it is a bit of a long game. We know it probably takes about 12 weeks to start producing our own collagen. And so I tend to bring patients back between the 3 and 4 month mark to see if we need to do any additional treatment at that point. And what I'm really looking for in my patients is the volume status. Have we got the volumization that we were after? But also I tend to look at the skin laxity and what firmness we finally achieved at. You know, very similarly to when you're doing your infraorbital treatments and you'll do your snap test in the infraorbital region. I tend to do that along the kind of lateral aspects of the face and see if actually we need to put a little bit more in, have a little bit more of that inflammatory reaction going on in there.
Great. So I'm just going to highlight something here, which is that as we move towards the chin and we move beyond this labiomandibular fold, the architecture changes, the subdermal architecture changes, and we move from what's called type 1 to type 2. And that means that the skin, the subcutaneous fat, and the muscles down here, the DAO, the DLI, all of it is very much a fused layer. And so that's why, as I'm passing my cannula through here and through the mandibular ligaments, it's much more tough than it is when I'm treating more posteriorly. And so we just have to be a bit patient with it as we move through little fibrous bands that divide the area. It's a tighter injection plane as well, so I've got to be extra careful not to create a nodule of Ellansé, which could then lead to a little lump under the skin. So I'm just, at the moment, creating my space for injection as I try and progress through the tissues. And I'm always focused on this little pre-jowl area where I really want to make sure that we have a little bit of product to ensure that we don't have this little interruption along the jawline after treatment. As I move towards the chin, I need to move anterior to the mentalis muscle. And you can see the little dimple here, which is when I'm starting to reach the boundary of the lateral aspect of the mentalis. And this can sometimes be a little bit tough to move past, but this is how I'm going to start to get into the anterior aspect of the chin. And here is where I can start to create that bit of projection that would be really nice for Charlotte's profile balancing.
I think that subcision before you start injecting the substance in those areas where there's more fibrosis, it's tighter, is key to getting a smooth treatment. You're right, have to warn your patient it's a little bit more uncomfortable, but just that subcision in itself, I think, can help with some of that collagen stimulation.
Yeah, that's a really interesting point. Is just inflammation generally is how we're creating this collagenesis process, and the mechanical effect of the cannula is part of that. Sometimes we are moving very close to the ligaments of the face. For example, here the mandibular ligament, which are themselves bundles of collagen. And so what do you feel about the benefit of injecting close to ligaments when we're using biostimulators?
I think you have to be careful in exactly what we were saying when you were kind of dissecting and doing a little bit of subcision in the lateral face. If you're getting too caught up in those muscle fibers, that's when nodules can start to form. We know that when any type of filler, but particularly this inflammatory type of filler, starts to go into what we call a SMAS or into ligaments, that's when it starts to become a little bit more irritant, and that's when you start to see those walled off nodules happening. But I think a nice smooth blanket around the area can only be a positive thing for helping with the general scaffolding of the lower face.
Final point now, I'm just going to do a tiny bit more on the anterior aspect of the chin. A little push here.
And often as you're going on top of the mentalis, it's all these fibers that are coming down from deep and really attaching into the dermis. And sometimes just subcising some of those off give a much smoother appearance to the whole chin area.
So the next thing I want to talk to you about, Harriet, is combining this with devices. So we have devices in clinic ranging from laser devices to microneedling radio frequency devices to or just general skin treatments like chemical peels. How would you sequence these treatments, and how would you combine them with devices?
That's a very good question. I think there's no gold standard recipe. I think often the best answers are aligning it to your patient's expectations. So there's always that one main concern that they have. If that's to do with the skin, then often I would start with skin treatments and maybe using resurfacing type devices. And then I would move on to some of these other treatments. If actually the bulk of patients that we see, it's sagging, it's volume loss, it's the general aging and the position of the lower third of the face, I tend to start with these treatments, because also getting a head start, because really we're not going to see the full results for a good few months. So getting a head start on putting these treatments into where they need to start working, then you can start on your resurfacing treatment. So thinking about incorporating things like lasers and working on the actual kind of epidermal surface of the skin, that tends to be a nicer way round to do it. From my experience, using these types of fillers, these biostimulators, and then using devices, people always worry that it's going to undo some of the dermal fillers that you've put in. They don't tend to. These are quite well heat stabilized, and a lot of the devices that we're using, they tend to be quite compatible.
What age do you think, now that you've got a lot of experience with biostimulators, devices, and hyaluronic acid gels, what age would you say is the right age to start each of these treatments on average?
On average, I would say mid-30s to early 40s tends to be the time. And when I have patients come to see me in that sort of age bracket, and the things they're saying are, my skin's saggy, everything's come down, I'm looking for that lift. And, they always do that 3-finger lift that they're looking for. That's when I think we need to start working on collagen. And whilst HA fillers definitely have a place and a role, really the earlier we can start on trying to get back to the collagen levels that they used to have, banking that collagen, because we know that there's a huge drop off going to come in the next few decades. So actually we start just working on trying to holistically build back that collagen as much as we can. Then after that, there's always a limit to what you can achieve. Then you might think about adding in some other volumizers or some other treatments after that.
Great. Well, we're nearly done here. There's the final drop in the marionette area, and we'll stop there. And I use this opportunity to just take a look from the top of the couch and see everything's looking nice and balanced for the chin. As with any time we are doing injections with fillers or with biostimulators, I always like to do a little capillary refill check. There's a lot of vascular connections in the chin, and we want to make sure that we have good capillary refill to the surface of the skin. All of that looks nice and healthy to me. Do you have any pain anywhere?
No, okay.
You're okay? Mm-hmm. You hesitated there. Did you want to say that? A little bit back here?
Yeah,
okay.
When you touch it, it's pretty okay.
Just from the draw. Okay. So now what we'll definitely see here is a bit more redness. So I'm going to sit you forwards and take a look in the camera. And here we can see now we've used 3 syringes of Ellansé, and you can see this immediate volumizing effect. What we're going to do is we're going to bring Charlotte back in 3 months, and then we'll do the follow-up, and we can start to see how that product has started to create this lifting and this collagen stimulating effect. The final thing I'm just going to demonstrate with Charlotte is a piriform fossa injection. I noticed there's a bit of maxillary recession as mentioned, and so here I'm going to be using Miley Extreme to inject down onto the maxilla. So we're just going to use an unprimed needle here, and we're going to touch down onto bone. 1, 2, 3. Now, well done. And you can see how far the needle has to go here to touch bone. So it's quite a significant recession, and this is why I think it's going to be a valuable treatment for Charlotte. We aspirate, and we give it a good 10 seconds with aspiration. We're looking for any flashback of blood in the hub of the needle. Okay. And then it's a little bit of pressure. Slowly injecting here. Brilliant. One of my favorite treatments for kind of subtly balancing the midface, and I can feel my filler down here on bone, which is exactly where I want it to be. And if you sit forward and look into the camera for us, hopefully you can appreciate just how much that can soften the nasolabial shadows there compared to this side. So let's do the same again on the other side. So the piriform fossa is one of our stage 2 gem techniques, and the reason for that is we do have a lot of variability of the arteries in this area. A little scratch, 1, 2, 3. And the main artery we think about here is the angular artery, which sometimes is found, usually found just under the skin, but it has been shown on ultrasound sometimes to be down on bone. And so we just have to appreciate one of the key concepts treating the nasolabial fold is the variability of those blood vessels. So we have various strategies to minimize risk. Generally, it's for more experienced injectors, but aspiration is part of our strategy. And knowing when to treat this with a needle or with a cannula, and how we would even get to this part of the face with the cannula is all part of how we would teach this kind of technique under our GEM framework. Great. Thank you. And just sit forward into the camera for us. What I see here now is a really balanced midface and lower face after both the Ellansé and the hyaluronic acid. There's one thing I'm just going to highlight for you, which is that I noticed that if I pull the skin back like this, I noticed that on this side, the chewing muscle is a little stronger on this side than this side. If I press here and then ask you to bite as hard as you can and relax, then we have more movement on this side. And I think this is what's causing a little bit of asymmetry and a little bit more of appearance of kind of a squared, stronger jawline on this side. I'm going to use a tiny bit of botulinum toxin for the aesthetic benefit of reducing the size of this muscle. You also mentioned that sometimes you get headaches on this side. Is that right?
No, I get a lot of jaw pain.
A jaw pain?
That side.
This side more than the other?
Yeah, just this side.
So we're not going to try and change the biomechanics. We're not trying to reduce the overall muscle strength, but I want to use a small dose, about 10 units of toxin, to reduce a little bit of the size of this so we can get a really nice balanced lower face. So rest you back. Okay, so to do this injection, you bite forwards again, really, okay, and relax. I've got the anterior border of the muscle here, and I'm going to be in this lower lateral quadrant of the masseter muscle. We don't want to be near the anterior border where it can connect with the risorius muscle, which is a superficial muscle. Regardless, my injections are deep down onto bone with a little tail off of the toxin. So if I inject down here, I will touch down onto the mandible. I inject just 1 to 2 units, and I'm going to bring it back a little and stop injecting. And I'm going to do that. If you bite again for me and relax, the majority of the muscle bulk is here, so I'm going to go down onto bone here, touch the mandible, inject, and slowly remove. Okay, I'm going to do a few more where I find the majority of that deep muscle activity.
What's the reason for the little tail, the kind of injecting as you're withdrawing?
So we want to make sure that we're treating the deep fibers initially, but we also want to make sure we don't miss the more superficial fibers, the fibers above the deep tendon of the masseter muscle. And that's because we can get some strange cosmetic effects if we don't get both layers of the muscle. So I've just done a nice diffuse 10 units of toxin, bite together again, where I think the majority of that muscle strength is. So final check, if you look back in the camera for us, Charlotte. So we're going to bring Charlotte back in 3 months' time, and we're going to see the benefit of all of those treatments. What we learned in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results. Okay, so we're back in clinic with Charlotte. How many weeks has it been now since the treatment?
It's been a couple of months.
Couple of months, about 8 weeks after treatment. And as you will have just seen from the video, we treated Charlotte with Ellansé, a very powerful biostimulator treatment focusing on the subcutaneous plane, generally treating in the lateral direction and also slightly towards the lower face as well, to try and improve the skin condition, to try and improve some of the skin texture, and ultimately collagenesis, to try and create some tightening of the skin as well. So I'm going to speak with Charlotte, get her view, and then we're going to take a look at the face and see the impact it's made just after 2 months. So Charlotte, how was the treatment?
It was good. Took a few days for some of the bruising to go down, but otherwise it's been pretty smooth sailing.
Pretty smooth sailing, okay. And pain out of 10 for the actual treatment itself?
There was a little bit of discomfort, but it was all manageable, and it came down quite quickly.
Okay, great. And what was what did you notice over the following weeks since the treatment?
So I've definitely seen some improvement in the firmness of my skin, some lift.
Okay.
And definitely some just general rejuvenation to the skin, and I'm pulling up here on the side.
Okay, pleased to hear it. So let's take a look at Charlotte's, starting with the skin quality. We should be able to notice at 2 months, even though this biostimulator is still having a biostimulatory effect, a tightening and a slight improvement to the thickness of the dermis. And that's just part of the mechanism of action of it stimulating the fibroblasts and improving the quality of the extracellular matrix here in the dermis. I noticed that we do have good skin elasticity. It feels. Does it feel at all painful to pinch like this? No, not at all. Good. And I think we can see a noticeable improvement to some of the very subtle signs of laxity and sort of descent of the soft tissues in the lower face. You can particularly see that along the jawline here, which I think is a really nice, very, very natural improvement. And you can see that on that 45-degree angle, a really nice profile and oblique view of Charlotte's face. If we look from this side, again, a very natural rejuvenation treatment. So this, we should expect it to continue for another 12 or 18 months of continued rejuvenation. And you'll note that there has been no volumetric change. We haven't injected any volumizers, any hyaluronic acid. So for patients that are not looking to have any filler, then biostimulators, a pure biostimulator like Ellansé, is a very good choice. So I hope that's been a very useful insight into how to assess patients that are suitable for biostimulators, how to inject them, and this follow-up should hopefully give you a good insight into what can be achieved just 2 months after treatment. So thank you for watching this case study and look forward to seeing you next time.